Okay, today's topic we will be discussing is that PCOS. PCOS or PCOD. You can call both of it because polycystic ovarian disease or polycystic ovarian syndrome. Everything is same. Okay, we will be coming to know about what this is and how you can find out in your home only. Means it is the few symptoms which you can only identify. You does not need a doctor to go and check. After that you will be diagnosed. No, previously only you can only kind of come to know about, okay, I'm having this kind of symptoms, so I'm suffering from this, so what are the measurements which I should be taking through. Of course, during PCOD or PCOS you need a medical treatment, but before that you also need to know that what's happening in your body. So today's topic is about PCOS. Myself, Dr. Meega from Homeopathic Clinic. I'm practicing homeopathy from 5 years. If you have any other diseases which you want to discuss with me, or if you want to really kind of consult an homeopath before going to the homeopathic treatment, or if you have any kind of questions about homeopathy or any medical advice, you can just contact me. Without any delay, let's talk about PCOS. Today in this video, I'll be talking about PCOS or PCOD. What are the 5 signs that you will be able to identify by yourself? I'll be saying the 5 signs which are majorly seen in the patients. If you have any 3, then think that you are suffering with the PCOD or PCOS. Okay. First one is dark, thick or blackish discoloration of the skin, means in the neck area, back of the neck, or in the underarms, where you will be noticing that, okay, this blackishness was not there for me, but why it came. Okay, that is one of the peculiarity. For some people it will be there, for some people it will not be there. So only I said in 5 points you should consider 3 points. If you have any 3 points, then you are with PCOS or PCOD. If you are having only 2 symptoms, then it's not that, it may be other things. Next one is androgenic alopecia. Androgenic alopecia is that losing of hair in the temple areas, means in the sides of your head. Okay, there if you are losing the hair, then also you can consider this. Next one is central abdominal obesity or belly fat. I'd already did a short video on the belly fat, how it is affected and what are the foods you should be taking for the belly fat or excessive lower belly fat and everything. Next one is craving for the sweets or desired sweets. The patient will be saying like, I did not know. Previously I was not at all having any kind of desire for the sweets. But now always I feel like I should be eating it and I have so much of craving. That is the one thing. Next one is very common. Everyone kind of know about it. That is irregular menses, because everyone knows that if they are missing out the periods, they just kind of think that they are going through the irregular periods. Okay, why all these kinds of symptoms happen? Because of insulin. Why? Means there is insulin, you are not maintaining your body's insulin resistance properly. Because of that you are suffering with this. And you can also check your thyroid hormones also for this common signs and symptoms. Okay, let's kind of come to know that if you're having any 3 symptoms in this, then you can just kind of consider of having the treatment. How homeopathy helps in the PCOS or PCOD? Homeopathy helps the patient to really solve this within, because homeopathy is like yours life. Okay, first we will take the case, after that we'll rule out that, okay, what is the main cause. Means for PCOD or PCOS, what will be the cause? First, regular cause or much more causes which we are regularly 95% which we are seeing is the stress.
So
or
just change
change
your dinner
of
time
lifestyle,
to
means
2
they're
hours
not
before
getting
you go to sleep.
enough
Everything will
sleep
be
and their sleep pattern is being changed, or due to stress, tension, or due to emotional disturbances, and due to some grief or due to some sadness, these things has been happening. Okay, what are the things which we should really kind of considering it before we take the medication? If you ask me like this, if you're not having irregular periods and you're having the darkness of the neck and the underarms, and you're having alopecia, and you're having obesity, then there is no need of taking treatment. Okay, what you can do is get up early morning, just sit and meditate so that your stress level calms down. After that, cut down your sweets. After that, go for a walk, do exercise, yoga, and for the alopecia, means for the hair loss, just thing is that oiling, massaging your hair just gives it okay kind of thing. If you are having irregular periods, then your cycle is being affected. Don't neglect it. Go for the medications. In the food or without the medication, of course, it's not going to be treated. Okay. I had one patient, she was a software engineer. She was having this PCOD from almost 2 to 3 years, and she was very new to the homeopath. So she said that, doctor, can I really trust the homeopathy treatment? I just wanted to get the suggestion, that's all, because I am fed up with these tablets and nothing is going all, because I am taking these hormonal tablets and nothing is kind of happening. I am getting hairs on my face, on my upper lip, and I'm looking very ugly. I'm gaining the fat and everything. So the fatigueness is there, everything. Because of that, I'm also kind of increasing the weight. So I said, it's okay, we will deal with it. Just take 1 month treatment, see the differences, then you will be okay. After that, we took her case. She was not having any dark is discoloration of the skin. She only had irregular menses, desired sweets, and belly fat. So we took her case and we corrected her periods first. After she started to get her periods regularly, then her desire for sweets was also cut down, and abdominal obesity was cut down, not with the medicines but with the exercises. Of course, it has already accumulated, so you should do the exercise and you should uh, regulate it. So this was the medicines treatment which I gave. It was done within 3 months, and she was such an happy patient. It what was the cause was that she was a software engineer, and she used to always look at the screen, and she used to sit. There was no movement and irregular eating habits, and she used to never sleep because she used to have shift wise duty, and her sleep cycle was affected, everything. So after managing everything, she's fine. Okay, moving on to the what are the medicines which are really helpful in the treatment of PCOS. First medicine which I'll be always kind of, means if I feel like okay, this patient can be treated with this thing, I'll be giving that. Means constitutional medicine is very important, but uh, constitutional diseases are also there, so I prefer this. First one is sepia. Why sepia? Is because sepia is given for the woman who has this kind of symptoms when menses do not start after the mother has stopped feeding after the delivery. And you can also give to the woman who feels always troubled mentally, and she is always stressed and she is very impatient, and you feel like she is in a depression that time. Sepia kind of really starts the menses very soon, and it also cures all the suppressed periods symptoms, so I'll be always giving CPR. Natramure is also one of the favorite for me, because natramure is given for the people who is having sedentary life, like software engineers and everything, because they will be not talking with others, and because of that everything happen. There will be suppression of periods, and the patient is very having so much of changeable moods, always crying and laughing, and the menses is delayed for 2 to 3 months, and in the young girls, and they have early morning headache and everything. Other one is ignatia, suppressed menses in the patient with very changeable moods, crying, laughing at unexpected times, and hysterical patients. Okay, these are the three go to home remedy for me for the PCOD or PCOS. If you really want the treatment, you can just consult me on the comment section, so that I will be approaching you directly. What are the foods you should be taking in the PCOS or PCOD diseases? I'll be doing another video, so please do like and subscribe, and also to get notification, press on the bell icon. Thank you. Have a nice day and a fantastic life.